Now let me just go over some of the things in the thing it says in support of needle exchange programs, that 3 or 4 pager. Texas has a serious blood-borne disease program. We have 56,000 people approximately living with AIDS or HIV/AIDS, and an estimated 387,000 Texans infected with hepatitis C. Public health officials are aware of the much larger number of hepatitis C uh, victims or people affected with that than with HIV/AIDS. But a lot of the public, I think, are not aware of the extent of that and not aware of how serious a factor that is for public health programs. The estimates for treating these diseases vary. They vary for AIDS, for example, not only because new treatments come online, but also they can get longer because when the new treatments come online, people live a lot longer with AIDS. So it's hard to pin down the exact cost of these of treatment for AIDS. But a November 2006 issue, which was a major study in medical care, estimates that the current cost of lifetime treatment for a person with HIV is $618,900, $619,000, projected to decline to about $385,000 in the future. Just treating just those Texans who have been infected in the last 5 years will cost an estimated $8.2 billion. So the net savings for each case is estimated to be about $303,000. Saving one case, preventing one case of AIDS would go a long way toward funding a first-rate needle exchange program. I point out here in the next paragraph that many people receive no medical treatment, but of those who do, because they are often people in poor circumstances generally, that is paid for by Medicaid in not just what might be the cost, but from 2001-2005, Texas state Medicaid costs for HIV/AIDS services totaled more than $377 million. Medicaid outlays for hepatitis C, more than $134 million. And if you live long enough with hepatitis C to qualify for a liver transplant when you're over 65, Medicare will pay for that for another $300,000. Now, as you know, most of you are involved in such programs. Needles are a very effective means of transmitting blood-borne diseases. The hepatitis C virus can live on an infected can live on a needle for about 4 days. This is just one of it's not the only way. Most people who get HIV/AIDS get it in the traditional manner through sexual contact. But more than 30% of existing cases are believed to have come through by injecting drug use, and of new cases, about 28%. So this is a very significant aspect of the spread of these diseases. Now, Australia and the Netherlands were pioneers in showing this can be improved. Public health officials in Australia started the practice of providing clean needles for injecting drug users. And the Netherlands followed suit very quickly, and the rates of both diseases, HIV/AIDS and hepatitis C, dropped by as much as 1/3 quite quickly. In the Netherlands, so to make it easy for people to come and places where they can go where it's warm and comfortable and well lighted, they can exchange, among other places, they can exchange needles in police stations. In Australia, machines that exchange needles are in the Parliament, are in the restrooms of the Parliament building, and nuns run the exchange in St. Vincent's Hospital where it was first started. Texas stands alone. Other states have different kinds of rules. Some you can buy them from pharmacies, some from other places. But Texas stands alone, it appears, as the only state in which injecting drug users cannot obtain needles legally. So as a lifelong Texan, it offends me deeply that my state is the last one to sign on to what is rational, perfectly defensible public policy. In fact, the last holdout against irrational on irrational, indefensible grounds. The science is clear. Without exception, American, or virtually without exception, American medical and public health personnel support making sterile syringes available to injecting drug users. There have been a number of federal studies. Without exception, they have concluded that they have endorsed access to clean needles. They have concluded that these programs do not increase drug abuse